Welcome everyone. My name is Luz Chacon, and I am the trainer and a consultant with the Iris Cantor-UCLA Women's Health Education and Resource Center. I'm the trainer for the Planning for a Healthy Home, Body, and Baby project. And we conducted, as I was mentioning in Spanish, a series of workshops related to environmental health and reproductive health in Spanish in September, and we had the request to repeat the series in English, and so that's what we're doing today and next week, although it's a little bit different, slightly different speakers in some cases, some of the same speakers. In any event, we want to welcome all of you here. We're really glad that you're interested in this very important topic, and today we have a panel of 3 people, including myself and 2 others who I'll be presenting later on. But before we get started with today's presentation, we'd like to actually conduct a poll. If everyone could please join in answering the questions that Jules from UCLA has just put up on the screen. If you can take a moment to answer those questions, we'd just kind of like to get a feel for some of your health habits related to this topic before we start. So we'll wait a few more seconds before we close the poll. Looks like over 80% have voted so far. Okay, so I think that we can go ahead and end the polling. It looks like to question number 1, do you eat canned food? 71% said yes, 29% said no. Do you wear shoes in the house? 46% said yes, and 54% said no. Wow, interesting. I would have thought that it might be the other way around. So I'm happy to see that a lot of folks don't wear shoes in the home. And then the third question, do you drink bottled water? 57% said yes, and 43% said no. So we will be learning about these 3 practices today. So I won't say very much right now about what is recommended, though I'm guessing you may know some of the answers, but we will learn more about this in today's presentation. So as I mentioned, there will be 3 of us. I will be starting off today's presentation. And so let me go ahead and share my screen. And I want to, as I'm setting it up, I want to mention that UCLA has had this project for a number of years. Julie Friedman, who's on with us today, is the manager of this project. And we are available to conduct these workshops. We conduct them both as workshops directly for community members, as well as a train the trainer for other organizations or health educators, community health promoters, for them to be able to share the information in the community. And with that, let's go ahead and get started with this portion. And then, like I said, we will have the 2 other speakers, Maria Bejarano and Ellie Tam, but I'll do their full introductions a bit later. So this is a subject that is very near and dear to my heart because environmental health is just so important. We are exposed to so many different chemicals. There's more than 85,000 chemicals that are used in use in the United States, and we think that people may think that those have been tested for safety or to see if there are any health risks associated with them, but the truth is that a very, very small percentage of the chemicals that are in use have actually been tested for safety. And there's something that is called the precautionary principle in other countries, where the thought is that something should not be made available until it's been tested and proven safe. Unfortunately, in the United States, we don't follow the precautionary principle, so industry actually is able to release chemicals or use chemicals and release them into the environment without a lot of testing. And so it's really important for us to be aware of what steps we can take to protect ourselves. It's not necessarily the case that we're going to be able to avoid exposure completely, but there are steps that can be taken to reduce our exposure. There are, as I said, there are chemicals in the air that we breathe, in the water we drink, the food that we eat, the products that we use, but we can't necessarily see them, smell them, or taste them. And very often, industry will say things along the lines of, oh, the amount of X chemical in this product is so low that it's not really a risk. But what we have to keep in mind is that there's an accumulation of chemicals in our bodies because we're exposed to chemicals from so many different sources. So, so over time, we can start to develop health issues. It's not a situation where it's going to develop overnight, but as they accumulate and over time, we may start to develop certain issues. And it's also important to know that some people are more exposed than others, and that can depend on where they live and the type of work they do. So sometimes your zip code plays a big role in your health because of where you live. There may be more contamination due to freeways near your home or factories near your home. And then again, the type of work that you do can play a big role in this as well. And our ethnicity can play a role in this as well, because African American communities and Latino communities tend to be even more exposed to toxins. And again, that has to do with where we live and the types of jobs that we have. So it's a reproductive justice issue because a lot of these chemicals can affect reproductive health, as we're going to be learning today. So women and children are more vulnerable, and that's for a number of reasons. First of all, women have the ability to get pregnant, and so if they're exposed to chemicals, which they are because we all are exposed to chemicals, but during pregnancy, they can be transferred to the fetus, and they can also be transferred to the baby through breast milk. Having said that, breastfeeding is absolutely the best choice. In fact, every woman has chemicals in her breast milk because we're all exposed to them. And all of the research that has shown that breastfeeding and breast milk is superior to formula has been done with milk that has chemicals in it, because there's no woman on the planet that doesn't have chemicals in her breast milk. And yet, despite that, it is still a much healthier way to feed a baby, and there's just a ton of benefits of breastfeeding as compared to formula. It has all the nutrients the baby needs in the form that's needed, in the form that's more absorbable. It provides antibodies that formula does not. I could go on, but I won't. The point is that even though women may have chemicals in their breast milk, it's still the best option. And then it's important to also recognize that babies and children are more vulnerable because they're also in developing. And so all of their organ systems are in development. So they're more likely to develop issues when they're exposed to different toxins. Women are also more vulnerable, not only because of our reproductive capacity or our ability to get pregnant, but also because we tend to be exposed to more chemicals. And that's because for two reasons, we tend to use more beauty products, and we tend to use more cleaning products. Not to say that men may not clean the house, but women are much more likely to be the ones doing more of the cleaning or work cleaning homes as domestic workers, or cleaning hotels and such. And so we're more likely to be exposed to more products, cleaning products and beauty products, which increases our risk. And as I mentioned, a lot of the chemicals that we're going to talk about today are what are called endocrine disruptors. I know that's a big term. Basically, it means that they alter our hormones. And so not only the reproductive hormones, different hormones as well, but today we're focusing more on reproductive hormones. So what that means is that people may have trouble getting pregnant. So they might have fertility issues, may have a harder time getting pregnant. And then if a woman does get pregnant, she's more at risk of having difficulties with her pregnancy, including a higher risk of miscarriage. And then reproductive health aside, being exposed to chemicals increases the risk of developing asthma as well as cancer. The health risks for children are that babies may be born prematurely, there's a greater risk of birth defects, and a greater risk of developmental delays, and something that we're seeing a great deal of today, meaning a lot of kids having learning difficulties, having behavioral issues, just very high rates of ADHD or attention deficit hyperactivity disorder. And then of course, both children are at risk of both asthma and cancer as well. So it's not just for adults. So we're going to talk about a number of different things that are in our home today that may expose us to chemicals. So everything that you see here, and we'll talk about a few other things. And the point is not to scare you or overwhelm you, because I know that this can be a scary topic and we may feel like, oh my gosh, there's so many different things that I'm exposed to. How do I reduce my risk? And that's exactly what we're going to talk about, because there are small steps that everyone can take to reduce their exposure. We're not going to be able to eliminate the exposure to a lot of these chemicals, but there are different ways, some simple ways that we can protect ourselves by making some basic changes, and that's what we'll focus on today. So let's start with talking about pesticides. Whoops, sorry, I went too far. Pesticides are an endocrine disruptor, or in other words, they can affect our hormones. And so it's not a good idea to use bug sprays or bug bombs. So an alternative to that would be to try to prevent bugs like cockroaches or ants from coming into our homes in the first place. They're just like we are. They need shelter, they need food, they need water. And so sealing the cracks, so that making it more difficult for them to get in the first place, being careful about cleaning up crumbs in particular to eliminate their food source. And then, although it's not shown in this slide, trying to eliminate the water source. So if there's any sort of leaks in the plumbing, getting those repaired so they don't have access to water. And then if there are bugs in the home, then using traps rather than the sprays or bug bombs would be a much safer alternative. So lead is another concern, and there are certain health risks associated with that, but I'm actually going to skip over this section of the presentation today because we have somebody with us that's going to be speaking later on that's going to cover this in much more depth. So I'm going to basically skip over this portion. I will say that dust is one of the greatest sources of lead exposure for children, but not only is dust a risk in terms of lead poisoning, but it's also a risk in terms of asthma, because asthma can trigger, or dust rather, can trigger asthma symptoms. And so the recommendations that I normally make related to reducing exposure to lead, such as using wet cleaning methods like a wet mop or wet rags or wet sponges, and using a vacuum with a HEPA filter. Same thing applies to trying to control dust to prevent asthma. So for people who have children in the home with asthma, or adults for that matter, it's really important to follow this recommendation to minimize the dust in the home. We also have somebody today, Maria Bejarano, who's going to be covering non-toxic cleaning products in depth, or how to make a non-toxic cleaning product on your own. So I'll just, briefly mention that all of these chemicals that you see here, all these cleaning products are toxic, and so we recommend that you not use them, and she'll cover this much more in depth. So I'm going to skip over this, and she's going to talk about how to clean and disinfect during the pandemic. So I will move on to talking about another chemical of concern, which is mercury. Mercury can also disrupt our hormones, but it can also cause, it increases our risk of heart disease. It also really affects the brain. It's considered a neurotoxin, so it's can be especially harmful for the developing brain and nervous system of infants. And it's found in fish. Pretty much all fish have some level of mercury. So that doesn't mean, oh, I think I went too far. No, this is right. It's not the case that you shouldn't eat fish at all. It's a matter of choosing the right fish, because larger fish have more mercury because it pretty much bioaccumulates. Large fish eat smaller fish, and so the larger fish are going to have higher levels. So you want to avoid shark, swordfish, king mackerel, tilefish, albacore, and yellowfin tuna. So for some reason that there was a slide, I'm not sure why it's not showing up, but there's a slide that normally has those larger fish that you want to avoid. So again, I'll repeat them: shark, swordfish, king mackerel, tilefish, albacore, and yellowfin tuna are fish that you want to avoid because they're high in mercury. The fish that you do see on your screen are the ones that are low in mercury, that are safer to eat. So that would be wild salmon. Wild is better than farmed. Farmed salmon has more chemicals, not just mercury, but PCBs, other chemicals. Tilapia is low in mercury, so is catfish, shrimp, skipjack tuna, or what is more commonly labeled chunk light tuna. That would be a safer type compared to albacore. So as I mentioned before, albacore tuna is higher in mercury, and that's the type that you want to avoid, and instead eat chunk light tuna. So fish is something that we do want to include in our diet, because in spite of the mercury that it has, it's very healthy for heart health. It's good for heart health as well as brain health, because it's high in omega-3 fatty acids, which are very important to include in the diet. It's more a matter of choosing the right fish. And it's also a good idea to eat less canned food. And so going back to the poll, I did see that the majority of people do eat canned food, and that's totally fine. We're not saying don't ever eat canned food. We're just saying try to eat less of it. And that's not so much because of the salt or the sodium that might be used in the can to preserve the food. It's what we're referring to now is because of the chemicals in the lining of the can. Most canned food is lined with BPA, or what's bisphenol A, but for short we say BPA, and that is in the lining of most cans. I am starting to see more and more canned foods that say BPA free. So that might be a better option. The other thing to avoid, or to eat less of, maybe not avoid, but just eat less of would be animal fat. So beef, pork tends to be higher in fat than, let's say, chicken or turkey. And the reason for that is because chemicals are stored in fat. And that's the case for us in our bodies. It's also the case in cows and pork. That's where the chemicals or toxins are stored. So when we eat fat, we're getting a larger dose of chemicals. As far as fruits and vegetables, since we're suggesting or recommending that you minimize or limit canned food, fresh and frozen produce is always a much better option. Sometimes people think that frozen is not as healthy, but frozen oftentimes is just as healthy. Sometimes it's even more healthy depending on the particular item, because fruits can sometimes be flash frozen at their right when they're harvested at the peak of ripeness, whereas fruits and vegetables that are fresh, sometimes we don't know how long they've been on the shelf. So in terms of reducing chemicals, again, fresh and frozen is best. And later on, I'll talk a little bit more about organic, but for now, I will just mention that it's also a good idea to choose more fruits and vegetables that have thick skins, because the other concern in terms of produce is pesticides. So if you're eating things like melons, watermelon, avocados, bananas, etc., then the pesticides are on the peel and aren't necessarily penetrating to the part that you eat. Of course, it's still really important to wash them very thoroughly before you slice them to try to minimize whatever toxins or pesticides rather might be on them before you slice them. The other chemical that is important to try to minimize our exposure to is plastic. All plastic has the potential to be harmful, but we in particular recommend avoiding plastic that's labeled with the number 3, 6, or 7. These types of plastic are more likely to increase your risk of a health issue, and so you can find them in canned foods, in disposable water bottles, in disposable cups and plates, plastic straws, and some baby bottles. And so plastic is also a hormone disruptor, and a lot of plastic has that same chemical BPA that I mentioned earlier. So not only do we find plastic in the items I just mentioned, but very often we use plastic containers to store our food. And most people are aware that it's not a good idea to microwave their food in plastic, and yet we do refrigerate it in plastic. And so what we recommend is that you don't do that. Instead, put away your leftovers or store food in glass containers like Pyrex. But another way to do it, if you don't want to spend a lot of money buying Pyrex, is you can reuse glass containers. Let's say you bought some spaghetti sauce or whatever other type of sauce or item in glass, wash that and use that to store leftovers. And for drinking water, we definitely do not recommend plastic bottles. It's recommended to use either glass or stainless steel containers, even if the plastic reusable water bottle says BPA free. Unfortunately, when manufacturers removed BPA from a lot of plastic bottles, they replaced it with another chemical called BPS, which may be just as harmful. So again, we don't recommend plastic at all, either glass or stainless steel. A lot of times people buy bottled water because they think that that's healthier or more regulated, but the reality is that tap water is much more regulated by the government than plastic excuse me, bottled water is. So of course, it is a good idea to use a filter. And as long as you don't have concerns about the pipes in your individual home, because depending on the age, if you have pipes that maybe are very old and maybe have leads are soldered with lead, then that could be an issue. And I'm not sure if Allie's going to touch on that. But if you're not concerned about your plumbing, you have plumbing that is doesn't have lead in it, then tap water or filtered tap water, I should say, is really the healthiest option. So again, plastic water bottles are not recommended. Not only can the plastic be harmful to our health, but the plastic is very harmful to the environment. And if you do have lead in your pipes, a good practice would be to let the water run for a while, for 1 to 2 minutes, the cold water, because lead tends to concentrate more in hot water. And then the other important reason to drink tap water, filtered tap water, is because it also contains fluoride, which is recommended for preventing cavities. Another type of chemical that can be harmful are flame retardants, which in the past were added to a lot of products, furniture, to baby clothes, to crib mattresses, carpets, etc. And the thinking behind this was that if there's a fire in the home, that flame retardants are not going to allow it to spread as quickly. However, the chemicals, the exposure to the chemicals on a day-to-day basis is probably going to be more of an issue or create a greater risk. And in terms of protecting against a fire, the best protection would be to have smoke detectors in, especially in all of the bedrooms. And that's what's recommended rather than buying products with flame retardants. Fortunately, because a lot more research showed the harms that can be caused from flame retardants, manufacturers aren't necessarily adding them anymore, but it's still a good idea to be on the safe side when you buy, let's say, a sofa or some other large item, to check the label to see if it says flame retardant free. And because many of us may still have items in our home from before they stopped adding flame retardants, it's a good idea to wash your hands very often, which is something we're doing in these days anyway due to the pandemic, but especially washing your hands before eating and teaching your children to do the same. So, and the items of concern would be things that were manufactured before 2005, because it was after that year that the industry, for the most part, stopped adding flame retardants to these items. I know I'm covering a lot of information and there may be questions. We will allow some time for Q&A at the end. I'm just going to touch very briefly on beauty products to say that the items you see here we recommend avoiding because they can contain toxic ingredients, including the ingredients that you see here on these labels. The reason I'm not going to go more in depth into this is because we will have somebody who will be speaking to this topic more in depth at our workshop next Tuesday. So if you haven't already signed up for next week's workshop, I'd encourage you to do so, because not only will they cover this more in depth, but they will also do a demonstration showing how to make a non-toxic beauty product. But basically, look at the label, read the ingredient list, and see if there's any of the ingredients mentioned here, and avoid buying them. Fortunately, more and more manufacturers are starting to make non-toxic beauty products and eliminating the use of the different chemicals that you see here, parabens in particular. Very often we do see items at stores that will say paraben free. And so if it doesn't list the ingredients, don't buy it. Typically, most things will have a label. So it's not only just that it doesn't have a label, but look for the ingredient list. I have gone into stores and looked, and there have been occasionally, I see cleaning products where it has a label, but does not list the ingredients. And so you have to wonder why the manufacturer might not include them. And if that they're not, most likely there's something they're trying to hide. So sometimes these products might be less expensive, but your health is too important. So it's better to be safe than sorry. We will also have somebody who's going to go in a lot of depth into mercury in face creams. So I'm only going to touch on that briefly today. There are creams on the market that are used to lighten age spots, and all of these creams have mercury in them. And mercury is a very harmful metal. It's a heavy metal. And putting anything that we put on the skin is absorbed by the body. So we might think like, oh, well, it's not getting into my system because it's just on my skin. But no, anything you put on your skin, think of it as like same as something you might be eating, because it will be absorbed. And so these creams are very harmful. There have been cases of women who have been injured seriously. There was a woman who was in a coma from having used creams with mercury. The mercury is the active ingredient that actually does lighten age spots or lighten the skin, but it's really not worth it. And as I mentioned, somebody will be speaking, somebody from the Department of Environmental Health at the state level is going to be speaking about this at next week's workshop. So I invite you to register if you haven't already done so. And as I mentioned at the beginning, the type of work we do can also play a big role in how much we're exposed to toxins. Again, somebody who cleans for a living, who's cleans either homes or hotels or office buildings, somebody who works in in beauty salons or in a nail salon, and we will have somebody who's going to speak about that issue next week as well from the California Healthy Nail Salon Collaborative. And so it's important to for people who are working in any industry where they're being exposed to chemicals, for them to follow all of the recommendations, all of the precautions. Legally, the employer has to provide protective equipment in the form of gloves or goggles or whatever other protective gear is necessary for that particular job. And so it's a good idea to make sure to wear all of that if you're working in some sort of industry where you're exposed to chemicals. There are also workplace wellness programs that that offer different programs at the job site that promote health. And so if you have that type of a benefit available to you, it's a good idea to participate in it. And for people who do work in an industry where they're exposed to chemicals, it's very important to be mindful of not bringing that into the home or trying to follow the recommendations to minimize the family's exposure. So doing things like changing their clothes before they come home, showering immediately when they get home, and doing that before, let's say, picking up the kids. And when I say picking up, meaning like hugging them or picking them up in their arms, washing their clothes separately so that you're not cross-contaminating the other family members' clothing, and leaving the shoes at the door. And that goes back to our poll question earlier. And so that's why I was very happy to see that a lot of you are not wearing shoes in your home and maybe leaving them at the door. Even if you're not necessarily working at a job where you're exposed to chemicals, that is a very good practice to minimize what you're bringing into the home on the bottom of your shoes. It's also important to know that because this can feel a little bit overwhelming, it's good to know that there are lots of organizations out there that do advocacy, that work toward getting more laws and regulations passed, or simply to supporting community members through doing tenants' rights work, workers' rights, legal advocacy, and community organizing to try to get more safety or pass policies that protect the community and workers. People who rent do have rights, and so tenants have a right to a lead-free, mold-free, safe, and healthy home, and that follows state and local building codes and health codes. And so, of course, landlords don't always comply with these different laws and regulations, and very often there are buildings that are in need of repairs. So I mentioned earlier when talking about the bugs and making sure that there aren't cracks or different ways that bugs are getting into the home, or maybe there is an infestation or there's peeling paint, which Ellie is going to talk more about when she talks about lead. So all of these can present a risk to the family, and landlords sometimes don't want to comply with the repairs or changes they need to make. Well, it's important to know that you do have rights and that there are resources to protect you at the city and the county level. And so here are a couple of resources that might be helpful if you are experiencing or you know somebody who is experiencing those issues. So I'll leave this slide up for a second if you want to actually take a picture, so you have the name of the agencies and the phone numbers available to you should you need them. It's an important resource to have at your fingertips. And as I was mentioning before, there are different community-based organizations that work to protect communities or to do advocacy, to do education. And so these are some of the organizations in the community that are doing this really important work. Esperanza Community Housing Corporation, and our next speaker, Maria Bejarano, that's who she works for. SAGE, which stands for Strategic Actions for a Just Economy, does a lot of work around tenants' rights. And then St. John's Well Child and Family Center is a large chain of community clinics where you can get, where you can access health care, but they also work in collaboration with Esperanza and SAGE in terms of environmental health issues. So getting your child tested for lead poisoning is an option there, as well as they also have asthma programs. So these are also important resources in the community to be aware of. Another really amazing resource that I like to promote all the time is the Environmental Working Group, because they do a lot of advocacy and policy work to get better laws and regulations passed to protect our health from chemicals in the environment. But they also have 3 different databases that are very useful, and it's important for us to know about them. One is their water database. So as I was discussing earlier, filtered tap water is really your best option, but it is important to know what's in your particular community. So you can go to their database, their water database, and you can enter your address or zip code, and it'll tell you what chemicals are in the water in your area. And they also have information on what filters will filter out the specific chemicals in your community or in your particular water. And so that's a great resource. They also have another database called Skin Deep, where you can enter the names of different cosmetics or personal care products that you may be using or want to buy or considering buying, and it'll rate them in terms of their safety. I believe the rating is like yellow or green, yellow, and red, that kind of thing. And you, they also have an app that does that, which is called Healthy Living, and it's a free app that you can download from your app store, where you can even just scan the barcode and it'll tell you the safety level of that particular product, not just for cosmetics, but even cleaning products, and I believe even foods. And then lastly, as I mentioned earlier, I wanted to talk a little bit about organic produce. The Environmental Working Group also tests all of the fruits and vegetables every year to determine the level of pesticides, and they come up with 2 lists. One list is called the Dirty Dozen, which lists the 12 most contaminated fruits and vegetables, and those are the ones that it's recommended that you buy organic. And they also have a list of what they call the Clean 15. Now, that doesn't mean that those 15 fruits and vegetables don't have any pesticides at all. They just have less. And so a lot of those are what I had mentioned earlier, fruits or vegetables that have a thick skin, so that you're not really eating the part that the pesticides were exposed to. So you can check out those lists by going to ewg.org. But really quickly, I'll read off the list of the fruits and vegetables on the Dirty Dozen. So again, these are the ones that are more contaminated that you want to, if at all possible, buy organic. And so those are strawberries, spinach, kale, nectarines, apples, grapes, peaches, cherries, pears, tomatoes, celery, and potatoes. So that's it for my portion of today's presentation. And I would, I'd like to at this time introduce our next presenter, who is Maria Bejarano. As I've mentioned, she works for Esperanza Community Housing Corporation. She is a community health promoter that graduated from the Esperanza training for community health promoters in 1996. And she's been working in South Central LA for more than 23 years. She's worked in an asthma program for 20 years and for a healthy breathing program for 6 years. Currently, she is the manager for the Healthy Homes Project at Esperanza, and she's very passionate about working with underserved communities. She's very dedicated and has a lot of respect for her community and loves to help and empower people to be able to defend their rights. And her favorite phrase is, "Small changes make a great difference." So I'm thrilled to be able to present Maria Bejarano today, who's going to give us a demonstration of how to make a non-toxic cleaner. Welcome, Maria. You need, sorry, Maria, you need to unmute yourself if you could.
Oh my goodness. Hi everyone, my name is Maria Bejarano, as Luz mentioned, and today I want to conduct how to make a green clean product. It's very easy, very cheap. The ingredient that I'm going to use it, but before that, I would like to talk about a little bit about my program, Healthy Home program. It's a program where we promotoras conduct home visitation. It's a home visitation program. This program is to English is my second language. That's why I have a little trouble. Okay, Healthy Home is a home visitation program where community health workers work with clients to protect against harm due to the housing condition. We focus on asthma, lead poison prevention, and pets. And today we wanna do this clean green product because chemicals, as Luz mentioned, is very bad for people, especially pregnant women and children. Okay, and now I'm gonna do my demonstration. And for this demonstration, we're gonna use white vinegar, baking soda, water, lime, whatever you want. It's lemon or lime, whatever you want. And you need to be very careful when you do this process, because all the time I recommend to my client do it in the sink, because sometimes you can have a spill, and to avoid spills, that's why I'm gonna use my container. So the first thing I'm gonna use, I always mark my bottles with vinegar. Sometimes I put a green clean solution, but in this case I put vinegar. So in this case, I'm gonna put first the measurement. We need 1 cup of white vinegar, 1 cup of water, and 1 teaspoon of baking soda. You can use a teaspoon measurement, or you can use this one, whatever you want, okay? In this case, I'm gonna put first I always, for whatever is easier for you, I always say hot water, hot vinegar. For me, I'm gonna put first the baking soda, a teaspoon, a tablespoon. And then I'm gonna add water, hot water of the bottle. After that, in this step, you need to be very careful, because when you add the vinegar, is going to put like a volcano, explode, a little explode. That's why you need to do it little by little, okay? You need to be patient. I don't know if you can see the bubbles. Oops. This is very cheap. Most of the people has vinegar, white vinegar, or on baking soda in the home, and it's not toxic. It has no chemicals inside. It's very safe to use it. And with this solution, you can clean the mold. This is very effective with mold. This little spot that born in the bathroom that make for the humidity. So you can use this to clean the mold. A little more. And then after I finish to add the half the vinegar, I'm gonna add lemon. The lemon is for the good smell. If you don't like the lemon, you can use I always recommend lemon, because one day people asked me if she can put like a lavender. If you want lavender, you can put it, but it needs to be very original, no with chemicals. But I use lemon. It's good smell. In my home, when I start doing this, I'm using, my daughter don't like the smell, but now she loves a lot. She make it by herself. When the bottle finish the solution, she make it by herself. If this green solution is It's good for people who has, if you use chemicals like chloros, fabuloso, Ajax, there are chemicals that can worsen the asthma symptom, the allergies, and also even though you don't have allergies with the time, if you use chloros all the time, fabuloso, Ajax, you're gonna develop allergies. So I almost done with this solution, with the clean products. As I say, this kill the mold, the fungus that produce mold. Use it, try it. It smells good. It smells like a lemon. So it's almost ready, but it's a little bubbles there. So I need to leave there to repose. So unfortunately, this don't kill the coronavirus. So the CDC all the time recommends use chloros, but as I say, chloros can worsen the asthma symptom, the allergies. We have alternative to use for coronavirus. The alternative that we recommended is, we recommended alcohol, 60% or more, or hydrogen peroxide, 3%. This is ready to clean. Also this, if you are outside, use hand sanitizer, 60% alcohol or more. Also, you can use these alcohol wipes, also 60% alcohol is kill the coronavirus. You can clean first and then disinfecting. When many people say, it's not the same. No, clean first. You need to clean. Clean it means remove the dirty, remove grease, remove dust, and then you can disinfect it with this product. This is very safe to use it. And also the alcohol. You can clean the bathroom lamp switches, refrigerator handles, stove knob, microwave handle, the phone, especially the cell phone. You need to disinfect it very often. If you are at home, wash your hands frequently for at least 20 seconds, very like that. What else? Alcohol, as I say, 60% is very good to kill the coronavirus. You can use, as I say, this green product, kill any other bacteria, any other viruses, but not the coronavirus. And that's it for me, for this solution. I hope you like it, this demonstration, and you try it at home. Many people don't like it because they smell like pork feet with vinegar, but it's good. If you have allergies, if you have asthma, you're gonna feel better after use this instead of chloros, instead fabuloso, or instead Ajax or 409 or ammonia. Try it, and if you don't like the smell, you can clean with hydrogen peroxide and disinfectant or alcohol. And for me, that's it, Luz.
Thank you so much, Maria, for the wonderful presentation. Yeah, so this is a great and very simple way to make a non-toxic cleaning product to protect your health, because all of the other cleaners that Maria mentioned can be toxic and can cause health issues. And so it's important, especially for, as she said, pregnant women, and or when there's children in the home, and especially if there's somebody who has asthma in the home. And so now I'd like to, we do want to leave about 5 minutes, if possible, at the end for any questions. I see that there's some questions in the chat already, but we will answer them at the end. I do want to go ahead and introduce Allie Tam. Allie Tam is the Health Education Manager at the LA County Childhood Lead Poisoning Prevention Program, where she plans and develops countywide program objectives and outreach strategies on lead poisoning prevention. She has over 15 years of experience working in the public health field. Prior to her tenure in LA County, she also worked at Asian Pacific Healthcare Venture as a program coordinator and has years of experience working in various healthcare settings. She received her master's in public health from USC with a concentration in health promotion and education. And she's a master certified health education specialist. Welcome, Ellie. If you'd like to go ahead and share your presentation.
Let's see. Right now it's marked as, one participant can share at a time.
Oh.
Oh, okay, I got it.
Now. Okay.
Let me go back from the beginning, sorry. Okay, good afternoon, everyone. Once again, I'm Ellie. I'm from LA County Public Health with Lead Poisoning Prevention Program. So I'll be going over details about lead poisoning awareness and prevention today. So just quickly, I'll be going over backgrounds and effects of lead. So what is lead? It is a bluish gray metal found on the earth. It is often used in paint, gasoline, glaze, pipes, and solder. It's very toxic when we ingest it. And there is no known safe levels of lead for our bodies. So there are 3 ways of how lead can get into our system. The first way is by ingesting in lead. So if there's any chipping or peeling paint in your home, and if a child picks up the paint chips and put it in his or her mouth, you can ingesting in the lead that way. Second way is by inhaling in lead dust. So over time, some of the chipping or peeling paint can turn into fine dust, and we may not be able to see it with our eyes, but we can breathe in the dust. So that's the second way of how lead can pass through our bodies. And the third way is by passing through the placenta from the mother to the child. So when a mother is exposed to lead during pregnancy, it can get carried on to the fetus. So how can lead affect a child's health? Lead can damage a child's central nervous system, kidneys, their reproductive systems, and at higher levels, it can cause coma, convulsions, or death. And we're especially focusing on children that are 0 to 6 years old because they are more at risk because it's natural for them to have a lot of hand-to-mouth activities during their development. They like to crawl on the floor, put toys or anything they see in their mouth. So as a result of this hand-to-mouth activity, it puts them more at risk for lead poisoning. And as I mentioned earlier, pregnant women are also at risk. Lead can pass through the placenta to the unborn child, and it can cause adverse pregnancy outcomes, such as miscarriage, stillbirth, premature birth, low birth weight, or brain damage. And next, I'll be going over some of the different sources of lead you can find in the environment. So for LA County, the number one source is lead-based paint in housing. It is a major source of major source for childhood lead poisoning. And lead-based paint, it is used up until 1978. So houses that are built prior to that there is a high likelihood that it contains lead-based paint. It is dangerous when the paint starts to deteriorate. So you can see the example pictures here. At the windowsills, there's a lot of friction as you open or close the windows, and that can create a lot of dust. And also you want to be careful when you, anytime you want to remodel or repair, you want to make sure that you do it in a safe manner. You want to contain the dust, cover the area with the plastic sheeting, and try to contain the area so the dust does not spread to the other rooms of the home. And here's some examples of deteriorated paint. When the paint starts to peel, chip, or chalk, or cracking, that's a sign of that it needs to be repainted, and it could be hazardous to our health that the lead is being exposed, and especially in a home that's built before 1978. And next I'll be moving on to take-home lead. So a lot of the, I listed some of the common occupations that deal with lead products, such as battery manufacturing, painters, recyclers, home remodeling, auto repairs. So these are some of the occupations that deal with lead. And as you can see in the diagram, as the workers work with the lead products, some of the fine dust can get into their shirt, their hair, or their clothing or shoes. And if the worker does not change out of their work clothes when they return home, he can potentially pass on the dust onto their family members. So you wanted to make sure that that they always change out of their work clothes, preferably before they return home at their work site. But if not, they should designate an area in the home where they should change out of their work clothes and shower immediately before they, hug their family members or play with their child. Next, some of the hobbies that people do may also be dealing with lead products, such as stained glass making, firing ranges, some of the bullets contains lead. Also, if someone likes to fish, the fish weights contains lead. So you want to be vigilant and try not to deal with these items. Handle these items around young children. Next is lead in soil. So for lead-based paint, it is both, we're referring to both interior and exterior. So in the exterior of the home, if the paints settle onto the soil can be contaminated with lead. And if a child plays in the yard, he or she can potentially, pick up the paint chips and put it in their mouth. And they could be exposed that way. As you know, gasoline is also has lead. It is banned in the early 1990s. So some of the busy roadways, soil around those areas or highways are more likely to be contaminated with lead. Also, soil around industries or factories that, that work with lead can also be contaminated. So some of the prevention tips is you wanted to cover up the soil with either grass, shrubs, or bark. So children does not have access to bare soil. And also, watch out, do not let children play with or eat bare soil as they play outside. Some of the home remedies also have lead. I've broken down some of the home remedies by different regions of the world. So in Asia or South Asia, some of the common ones are Balangoli, some Ayurvedics, Peloa or Sindor, and also some traditional Chinese medicine. In Latin America, some of the common ones are Ozicon and Greta. And these are homemade remedies used to treat stomach aches, and they have been tested to contain up to 95% lead. In the Middle East, some of the common ones are surma, kohl, or sumac. People often use these for their eye makeup. And some of these have also have been tested to contain high levels of lead. And some spices, such as chili, tamarindo, or paprika, or turmeric, may also been tested to have lead. Some of the tree or the leaf itself, the paprika or the turmeric itself does not have lead, but it is during processing when they grind up the powder, some of the lead in the machinery could get into the spices. So that's how it gets contaminated. And lead in dishware are also common. You see a lot of hand-painted items that's very colorful or has a shiny glaze on the top, on the surface. That's a sign that it may have lead in these dishware. So some of the dish or pots are more likely to have lead if they are handmade. Oftentimes you can find them maybe in a discount market or a flea market. Some of the crystals may also have lead. And a lot of these items may be imported from outside of the US because other countries may not have the same regulation as the US. So a lot of these items have lead. And also some of the dishes that may be old, worn, or chipped or cracked may also, the lead could leach into the food or the water that's being stored in the ceramics. And there are testing kits that you can purchase at any hardware stores. We recommend testing kit that's called Lead Check Swab, and you can use it to test your potteries at home. It won't tell you what the level is in the pottery, but it will tell you, it has a swab where there's a solution where it reacts with lead and it turns red or pink. That's a sign that it has lead in the ceramics. So it's a way to tell whether it has lead or not, but it won't tell you the level. But you can try to purchase it at any hardware stores. So some lead in candies are also, some candies also have lead, and these are, a lot of these candies contain chili powder or tamarindo powder. So as I mentioned earlier, is during when the powders gets processed, the lead gets leached into these powders. And when they put in the candies, that's how some of the candies contains lead. And also sometimes the ink on the wrappers may also have lead, and that's another way that lead could leach into these candies. So you want to be careful not to give these contaminated candy to young children. And if you go to our website, we do have a list of all the candies that's been recalled on our, that's listed on our website. Some lead and also may also be found in costume jewelry. If you can see some of the common, these are some examples of jewelry that has lead. A lot of these are is a coating that like the gold coating or the crystals, the fake crystals that has lead. So you want to be careful not to give these jewelries to young children. Not only because of lead, but also they could potentially choke on some of these items that has small pieces. Also, next is lead in toys. So effective February of 2009, there is a limit on the amount of lead that's on products that intended for children under 12. So some of the tips that you wanted to look for is you want to be careful about older toys or inexpensive imported toys, not to give this to your child. Also, you want to examine the toys of any wears and tears or signs of wear and tear, because if the surface is painted, when the toys start to crack or the paint starts to peel or crack, some of the lead can leach in to our bodies. Also be aware of what children put in their mouth. So if the toy has lead-based paint in it, if the child starts chewing on it, they can eat in the paint chips. Also, we recommend washing toys regularly with clean on a regular basis to clean off the household dust. We also recommend Consumer Product Safety Commission website, cpsc.gov. You can search on any of the recall items for lead or other consumer products as well. Also, you can go to our our lead program website, publichealth.lacounty.gov/lead, to get a list of all some of the toys and also the candy flyer and our other health education material. So next, I'll move on to some of the prevention tips. So some ways to reduce exposure in a home that's built before 1978. If there is chipping or peeling paint, you want to cover the paint with cloth or plastic sheet until it's fixed, so your child does not have access to chipping or peeling paint. Bare soil, as I mentioned earlier, you wanted to cover the bare soil with shrubs, grass, or bark to prevent children from accessing bare soil. Also, you wanted to inspect the home if there's any moisture damage. When there's moisture damage with molds or mildew, the paint deteriorates. So you wanted to fix the moisture problem to prevent peeling paint. So if the paint starts to chip because of the moisture damage, then the lead from underneath may be hazardous. You also want to keep the rooms ventilated to prevent any moisture damage. Also, you want to test your home for lead. You can call our 800 line and we can guide you to some of the ways that you can test your home for lead. Also, we recommend wet mopping. Do not use a dry broom to clean the floors. That way, you don't want to spread the dust throughout their house. So we recommend wet mopping for cleaning. Also, wet wipe as well. You also want to use a vacuum that has a HEPA filter. That will pick up all the fine dust that settle on the floor. Also, we recommend frequent hand washing, at least for 20 seconds or more. Some of the times that we recommend children that they should wash their hands before they eat, after they play outside, and before they go to sleep. And also because of the pandemic, we also encourage frequent hand washing. Some nutrition can help with, good nutrition can help reduce our body's lead levels. So giving a child a diet that's rich in iron, calcium, and vitamin C will help their body fighting off lead. So some examples of iron is dark leaf vegetables, lean meat. Calcium is milk or yogurt or figs, and vitamin C, citrus fruits or strawberries. Okay. So you may wonder, how do I know if my child is lead poisoned? Here's some commonly reported symptoms, such as abdominal pain, weight loss, nausea or vomiting, irritability, or hyperactive. These are some of the symptoms that may mimic a flu. So a lot of times children get misdiagnosed. Or sometimes these symptoms may not even appear on a child that's lead poisoned. So the only way we know is with the blood lead test. And most children with lead poisoning do not look or act sick. And we recommend children get tested at 1 and 2. If a child are on public funded programs such as Medi-Cal or Healthy Kids or Healthy Homes, they can, the doctor are required to test at 1 and 2. But if they have private insurance, and it's the parent would need to request that from the doctor. And that concludes my presentation on lead. If you have further questions, you can feel free to call our 800 line, 1-800-LA for lead, or visit our website at the bottom. Okay, thank you. And I think we're ready for questions or at the end.
Yes, thank you so much, Ali, for all of that important information about lead. So I see that there've been a number of questions that have come into the chat. So let me go back to the top to answer them in order. So somebody asked how to know if there's lead in your pipes. And so I know, Allie, you gave the phone number to the LA County Lead Program about testing. Does that include testing water? Is there information that they can obtain from that number about how to get the water tested?
Yes, you can call us and we can provide you a number to Long Beach Laboratory, and they do water sampling, water testing.
Great, thank you. Somebody asked if the recording of this, will it be shared later? Jules, can you answer that one?
Yes, it'll be shared later in an email along with the resources from today.
Great, thank you. And somebody asked if we can provide the link for next week's discussion. It's on the same flyer. So if you do have to register separately through Eventbrite. So if you only registered for today, use that same link on that flyer to also register for next week, November 17th. Jules, do you want to say anything more about that?
Yeah, that's correct, everything that you said, and it will be the same Zoom link as today's. So you can use that same link, but it would be helpful if you could register again for next week.
Awesome, thank you. Somebody asked if we'll be able to print the PowerPoint, and I think I addressed that because you will receive it. Let's see. Somebody said it was a great website, very eye-opening. I think they were referring to the Environmental Working Group website. Somebody asked, what is recommended to wash our fruits and vegetables? That's a great question. There was a study that was done with 3 different ways of washing fruits and vegetables to see which way is most effective in removing some of the pesticides. And they compared plain water and a vinegar solution, and water with baking soda, and the most effective was water with baking soda. So in other words, like you can soak them in let's say the sink or in some sort of a basin with a solution of water with a baking soda, let's say a tablespoon, just let them soak for a while and then rinse them off afterwards, and that helps remove some of the pesticides. Let's see how. Somebody asked, do you recommend completely avoiding turmeric, or are there certain turmerics that don't have lead? I love that question because turmeric is such a healthy thing to include in your diet. It's an anti-inflammatory, and so I think it is important to know if how to select one. So, Allie, do you have any information on that?
Yes, usually if you purchase turmeric powder, that's, you wanted to find out what the source is from. So usually if you buy at a market that has a clear packaging, usually those are from the right channels. So those are usually safe, but it's the one that's that you buy from maybe like a small market, or some of the powder that's maybe repackaged, or those are the ones that you wanted to watch out for. So you wanted to, some of the source that you may not be known are the ones that are more, that may have maybe contaminated with lead.
Great, thank you. Do any programs offer free lead testing kits? Ellie, could you answer that one as well?
Yeah, we don't offer free lead testing kits, but you can purchase the home test kits at any hardware stores. Also, if you call our 800 line, we can recommend, give you the number for Long Beach laboratory, and they do offer the, at the lead testing at a reduced cost versus a private laboratory.
Great, thank you. Somebody asked, what about wet mopping for hardwood floors? Allie, that one goes to you too.
Yes, we do recommend wet mopping hardwood floors.
Yeah. So it looks like somebody, last question is, what would be measurements for the water and baking soda? Is that a question for Maria in terms of the non-toxic cleaner that she made? I'm assuming that's what it is. If it's not, if you could clarify in the chat. So let Maria answer that question.
What's the question? Can you repeat again?
What would be the measurements for the water and baking soda? Oh, sorry, she's asking for the fruits and vegetables. So Maria, it's more for me. Yeah, I don't remember the exact measurements. I apologize, but I believe I think it's like a tablespoon of baking soda to, probably just like some, bin with water, or like a tub or a big bowl, maybe yeah, I would say like the amount of water in a big bowl and 1 tablespoon of baking soda, but I will look it up. And if you're attending next week, I will have the exact answer for you then, because I don't recall from having read the study the exact amounts. I will say this though, because I'm always all about finding solutions that are cost effective, and there are those fruit and vegetable washes that you can find at the stores. They actually tested those too, and those don't perform any better than just plain water. So don't waste your money buying those. They're really not effective. So it looks like those are all the questions. I don't see anything else in the chat. If anybody has any additional questions, feel free to enter them now. Otherwise, oh, Maria, you want to say something else?
Yeah, let the people know if you have people, people who has asthma or who has pests like roaches, bed bugs or mold in home, just refer to us. We provide with bucket with a green cleaning product, and also if the person has asthma, it depends on the symptom. We also provide with a vacuum cleaner if they have a carpet, or air purifier. As I say, it depends on the symptom. This program is only for 6 months. It's one initial visit and then a phone call at the 3 months. And the 6 month is 6 month follow up, and we finish with the home visitation. Right now we are doing virtual visits because of the pandemic, but we are still working. If you know people who has asthma or who has high lead levels or who has pets, just let me know. Thank you.
And is it, can you put your information in the chat, the phone number, or because yeah, if you can put that information in the chat, Maria, so that anybody with
I'm gonna put it now.
Great, thank you. And is that from any area, or is it in the South Central LA area?
Central LA, lamentablemente.
Yeah, unfortunately it's only if you live in South Central LA. However, there are other Healthy Homes programs. I know, like there's Pacoima Beautiful in the Valley, and so possibly you can get a referral to another Healthy Homes project, and because that is a really great resource.
And if I could just interrupt for a second, this is Julie from the Women's Health Center. We will send a follow-up email with some of these resources and information in the next week or so. So I don't want everybody to feel like they have to write down everything. We'll send all the information later on.
Great, great. Thank you, Julie. Well, thank you everybody for attending today. We're really happy that that you joined us. We hope this was helpful information. And again, we encourage you to participate or to attend next week, same day of the week, Tuesday, same time, 3 to 4:30. We're looking forward to seeing you then. And thanks again. Have a great afternoon. Bye-bye. And thank you to Ali and to Maria for your presentations today.
Thank you.
Thank you. Bye.
Thank you.
Do you have a second?
Let me stop my video for a second.
Can I borrow your car?
What for?
My car broke down.
Helena, are you still there? Helena? Helena, are you still there? It's Julie.